Hi, I'm Dr. DeFabio, and it's a great day to talk rehab. There are three types of common postural distortions in general that we see in the office. Upper crossed postural distortion, text neck, okay, slumped over. Lower crossed postural distortion in the lower back, like a sway back, and pronation distortion, knock knees. So today we're going to talk about the lower back, and the most common postural imbalance we see is the lower crossed postural distortion or sway back. So let's look at what that is first, and then we're going to show you how you can fix it with common, easy to do exercises at home. So Mike, say hi to everybody.
Hi everybody.
There you go, Mike. So let's show everybody from the side view what a lower crossed postural distortion would look like. So what you're going to have is that increased curving through the lower back, that sway back. But sometimes that isn't always real bad when you're standing, but it happens when you move. See, that's the difference between static alignment and dynamic alignment. So let's have you do a squat. Bring your hands up over your head. We're going to have Mike do an overhead squat. Now he's got nice curving through here. Now that's good. That amount of curve in his spine, see, just a little bit is very good. However, if you go into a squat and you have lower cross distortion, go ahead. Show us what happens, Mike. There it goes. You see what happened? How his back starts to get a big arch in that. Look at that big arch, okay? That means his hip flexors are tight, all right? Lats are tight, okay? Glutes and hammies are weak. Come on up. Now, sometimes when you do an overhead squat assessment, you don't see that, but there's still an imbalance. So if you put your hands on the hips, Mike, first just give me a good squat with hands on the hips. Go ahead. See, again, spine stays good. Tuck your chin, your hands up a little bit. There you go. Just a little bit of a curve, okay? That's nice. Now, show me what happens in a lower cross with those people. Boom. Look at that big arch, okay? That's where we get into trouble. That's that lower cross distortion, okay? Tightness in the hip flexors, tightness in the erector spinae, the low back extensors, weakness in the hammies and in the glutes. So, what do you need to do? You need to stretch the tight areas and strengthen the weak areas. So we're going to go through those progressions in our next exercises. So this is the first video in a series of actually 4 videos on how you can strengthen those areas and stretch the tight ones. So now that you know if you have lower cross distortion, you know whether this playlist is for you. I'm Dr. DeFabio, and it's been a great day to talk postural distortions in rehab.